Thank you very much for that lovely introduction, and it's such a pleasure to be here, part of such an important day. I'm just going to give a very brief overview, unfortunately, of a lovely project which I've been involved in recently in association with the PDSA. I'm going to give a very quick idea of the project background and how the project was designed, and then a few examples from my data analysis around the concept of moral stress, and also testing ideas around ethical discussion as practice in veterinary teams. So just as an idea of the background for this work, I'm sure most of you know the PDSA, but if you're not familiar with it, it's a veterinary charity, a large veterinary charity in the UK with 48 vet hospitals. And they published this piece of work back in 2020 based on staff survey data, which demonstrated that less than half of staff at their hospitals were completely satisfied with the level of discussion about ethically challenging cases. And that's the essential starting point for this project. And these are some free text responses from that staff survey data, which indicate why they thought that improved ethical discussion would be beneficial. And they seem to have identified really key themes around reducing animosity between staff and also animal welfare claims, perhaps preventing prolonged suffering as well. So that was the idea behind the project, which I co-designed with the PDSA. As we all know, research in this area is very difficult to fund, and this was funded through a secondment fellowship from the Wellcome Trust, which put me as a researcher in contact with an industry organisation with the aim of doing some practical research embedded within an industry context. So this is a 6-month project. The PDSA's aim was to do something practical, to actually try to work on this problem that they had and to test perhaps some new approaches. And due to my research expertise and the funders' interest, we were looking at a qualitative study and a focus on mental health application or implications. So what we came up with is a qualitative longitudinal ethical study. We conducted 9 focus groups across 3 charity hospitals. And those were arranged as groups of up to 6 veterinary staff who normally worked together, but it was going to include veterinary clinicians, veterinary nurses, and also, if possible, non-clinical front-of-house staff. And each hospital ran a series of 3 focus groups, one after the other, with a week or longer in between. So it was longitudinal in the sense that the same group of individuals took part in the focus group each time, and they were to build up their conversations and their ideas, and also feed back on their experiences at previous sessions. And each of those participants was also offered an individual interview at the end of the study. It was a semi-structured study with these 3 themes addressed. I won't go too much more into the methods because we won't have much time for the interesting part. So we'll get on to thinking about what we learned about moral stress. And one key finding really was that this data supported the definition of moral stress, which has been proposed in other areas of work, which is around it feeling like an inability to do what it is that you want to do in an ethical sense. For example, let's look at this quote. Sometimes it's not knowing what the right thing to do is, but not usually. Usually it's kind of like a frustration, something that you feel is appropriate morally and ethically, and you can't do it. I know that bunny rabbit needs to go to heaven, but if she won't let me do it, that's when you get the moral distress. And this also raises the point that we've got a lot of competing concepts in this area at the moment around moral stress, moral distress, moral injury, which we heard about this morning. And I think those areas are rightfully important, and we're working very well on clear definitions. But in this study, moral stress was really not about the big, dramatic ethical challenges. It was actually more about mundane, everyday challenges in meeting vets and vet nurses' moral obligations. But that the important thing is that these very low-level ethical challenges also have the potential for mental health consequences. So in this study, I identified two main causes of moral stress, or two main themes around moral stress, which were different types of barriers, two different types of barriers to ethical activity. One of which was practical barriers, just physical problems around doing what it was that vets and vet nurses felt was right. Often this would be something perhaps financial, and this was certainly very common in the charity setting. But what's really important about this is that even when the teams identified a practical barrier to ethical activity, they still had feelings of personal responsibility. So even when they were unable to change these practical barriers, they still went home with a feeling of personal disappointment and responsibility. The other type of barrier, which is probably less well understood, is about relational barriers, which were very clear in this data set. And this is where, unlike a practical problem, it's another individual, another person, that is standing in the way of vets, vet nurses, undertaking what they think is best. Quite often people would talk about this being the animal's owner, but equally commonly it was actually a veterinary colleague. And we've had a lot of discussion today about interpersonal relationships between colleagues. And I think this is an interesting way to try to understand the causes of friction, perhaps, in veterinary teams. These participants often had no formal opportunity to discuss these relational issues, and they were very prominent, actually, in the focus group discussions. So just a really important central point for this work is just thinking about this concept of relational barriers and moral stress. And it might sound obvious, but perhaps we need to think a bit more about the fact that it's not just our relationships with animals that contribute to moral stress in the veterinary setting. And perhaps we need to think a bit more deeply about interpersonal relationships between people. And this means thinking about our research methods, need for qualitative research and social scientific methods, and thinking about what type of interventions we can use to improve these relationships. So for this study, that was about trying to test ideas around around ethical discussion for improving moral stress. And I just wanted to remind us really of the RCVS's drawing of attention to these multiple ethical responsibilities which happen in the veterinary clinic. And in this study, we were trying to reframe it more to think perhaps about ethical relationships rather than just ethical responsibilities. And to facilitate our discussions, I used the veterinary ethics tool, which none of the participants were familiar with, and perhaps you won't be either, but is unusual actually in drawing attention to the different relationships, ethical relationships which exist in the veterinary setting. And this was actually really useful to help me to structure and facilitate these conversations. And team members reported finding it very intuitive to think about ethical discussion, ethical responsibilities in a relational sense. They even suggested that this looked like the inside of their brain, and it was actually quite helpful for them to be able to demonstrate the way that they thought about relationships and the complexity of veterinary decision making. So, just to draw out one key finding really around thinking about relationships and ethical decision making during our discussions, and that was about context and complexity in these relationships. Even things that could potentially seem quite simple were actually very complicated. And in the context of a charity veterinary hospital, this was sometimes down to financial decision making. And just to highlight this quote at the bottom, how much can you afford to pay today? And the woman kept saying, I have £80 in my bank until next Friday. But if that's all your money, you can't pay £80 to us today. That needs to get you to next Friday. You still need to eat. You still need to travel. And I suppose this really demonstrates about context, in the context of disadvantaged clients who have specific vulnerabilities, perhaps at risk of unsafe debt. Vets and veterinary teams were even taking moral, ethical responsibility for financial decision-making on behalf of the clients and thinking about their financial well-being. So this really demonstrates thinking in a relational sense. It's not as easy as asking if something's financially viable or not. So finally, I'm just going to briefly pull out two ideas around ethical discussion and the importance of it in veterinary teams. One was thinking about the ethical discussion of active cases, and this was what was likely to improve clinical decision-making within the hospital. Sometimes this happened informally. Teams would like more access to ethical discussion of active cases, where they'd be thinking about helping patients by improved clinical decision-making. But actually, this study was able to draw attention to the benefit of reflexive ethical discussion as a group. This wasn't really about thinking about altering clinical outcomes, but it was about understanding better each other's roles and ethical responsibilities by reflecting together within the group. And I just want to leave you with a final quote, which shows how it can even alter perspectives, perhaps, on these relational barriers. I think after our discussion last week, when I went away and thought about it, I'd never really considered the fact that the vet would have to go away, convince somebody that doesn't want to give up their pet that actually that's the best case. So it made me rethink. Maybe I'm too quick to say, put it to sleep, and I didn't say it today. So I think it's a really nice example of how this study has allowed us, through its longitudinal approach, to reflect back on the benefit of having ethical discussions as a group within the hospital, and even to think about the possibility of behaviour change, as well as reduced friction in teams. A lot of this has been published in this paper, which is in Animals Free Access, if you want to have a look, and I'll be really happy to talk to you about any questions. Thank you.
Thank you, that was really fascinating. I guess thinking from the healthcare, human healthcare perspective, we see things like Schwartz rounds are quite good for reducing friction. I'm just wondering if that might be appropriate within the veterinary.
Yeah, very much. And I think on the next stage of this work is very much about thinking about how we can embed this at the PDSA, but also within other veterinary organisations. And certainly Schwartz rounds is a really good model that I am looking at in terms of what already exists in human healthcare settings. And it's interesting to note that Schwartz rounds for human healthcare professionals are really not actually explicitly meant to be around ethics and ethical decision making, but more around social relationships and emotional aspects of work, which are kept separate. And that's made me very interested, because I think part of this might be that in the human medical profession, there are other provisions made for ethical decision making. They have ethical oversight at different levels within hospitals and within teams, which don't exist in the veterinary setting. So I wonder whether that's why this sort of format might be becoming something that's more practical and realistic within the veterinary profession. But for me, actually, and I think this work demonstrates why, relational and emotional aspects of veterinary work are often ethical in nature, and I think it is quite difficult and perhaps unhelpful to separate them. So I'm certainly looking at that type of model, but incorporating more of a focus on ethical decision making and the challenges that it poses. Thank you.
Great, thanks.